Hello and welcome to the latest episode of Research That Matters. I am Dr. Chris Freitag with Lavaca County Chiropractic in Hallettsville, Texas. And this is our weekly post about what the science and what the research is saying about topics that matter to you. And today's topic is relieving migraine headaches. Few things can ruin your day as much as a headache, especially headaches that are migraines. However, relieving migraine headaches in particular can feel impossible. They can appear out of nowhere, even though they may hint at their arrival with symptoms like visual discomfort and even nausea. Whatever the symptoms of your migraines, they are something you don't want to have to suffer with. Knowing when a migraine is starting and understanding what matters when it comes to preventing and relieving migraine headaches is critical to improving your quality of life. Let's take a look at the 4 phases of a migraine headache. First is the premonitory phase. This phase is usually the warning that a migraine is coming on. Many people will experience mood swings, neck stiffness, or even constipation. Second phase is an aura. About 1 in 4 people who suffer migraines will get an aura, not all. Migraine sufferers often report visual or sensory auras in the minutes before the actual headache. Visual auras can result in flashing lights and blurred vision, whereas sensory auras affect speech and the ability to think clearly. Vision problems usually start 20 minutes to an hour before the headache. Even if you don't get an aura, the headache itself may cause vision trouble. And third phase is the actual headache. A migraine headache can be moderate or severe and is likely to occur on only one side of the head. Migraine sufferers will notice that their headaches worsen with physical activity, so rest is critical. And the last phase of a migraine headache is the postdrome. The final phase that occurs when this headache ends and leaves the person feeling exhausted. So, treatment options for relieving migraine headaches. Many migraine headache sufferers do not receive effective care. For example, in the United States of America and the United Kingdom, it's estimated that only half of chronic migraine sufferers seek the help of a healthcare professional despite the life-altering symptoms they are suffering. These symptoms usually include throbbing headaches of moderate to severe intensity on one side of the head, the appearance of nausea and vision changes, and recurring episodes lasting anywhere from hours to days. Most migraine sufferers are solely reliant on over-the-counter medications, even though there are no guaranteed options that exist for relieving migraine headaches. It's estimated that half of the people who experience chronic or occasional headaches continue to self-treat with over-the-counter pain medications despite the increased risk of experiencing rebound headaches that can happen as a result of medication overuse. This risk is associated most with aspirin, acetaminophen, which is Tylenol, and caffeine combinations. Many people aren't aware there are non-pharmacological ways to manage their attacks. Most of our migraine patients often state this as a reason why they waited so long to seek chiropractic care for their migraines. Similar to the treatment of cervicogenic and tension headaches, it is possible to decrease the frequency, intensity, and the severity of your migraines with a combination of lifestyle changes and chiropractic care. While the cause of migraines may remain completely unclear, there are specific triggers that are often attributed to their onset. Knowing what those triggers are and making proactive changes to daily habits that may be associated with those triggers is important to finding lasting relief from migraine headaches. In one recent study, researchers observed a significant reduction in the duration of migraines for those participants that received chiropractic care. You can start effectively relieving migraine headaches by being proactive with your daily habits. Making time for periodic chiropractic care is an important step in finding relief from migraine pain. So don't skip your next or your first chiropractic treatment. Now, what about those triggers we talked about? Here are some of the most common. Consumption of alcohol or caffeinated drinks and tobacco. Periods of stress. Exposure to intense lights or smells. Periods of intense physical exertion. Changes to sleeping or eating habits. Certain medications. And consumption of aged, salty, or processed foods and certain food additives. Migraine sufferers do well with preventative measures such as diet changes or taking steps to reduce stress. If you need help determining which triggers are contributing to your headaches, don't hesitate to ask us during your next appointment. To ensure you are on the right path and headed toward lasting relief from your migraines, it's wise to connect with a healthcare professional. Dr. Google isn't really a doctor after all. Our compassionate team has personally dealt with our own share of migraine headaches, and we are here for you. From lifestyle optimization advice to chiropractic adjustments and beyond, let us help you make those life-altering migraines a thing of the past. So thank you for joining me today for your latest episode of Research That Matters. Click the like or the follow button to make sure that you continue to receive the latest updates from the research that matters to you.